Hello again, everyone, and welcome back to the channel. In today's video, we're going to be answering the question of who is eligible for Medicare. Before we dive too much into the video, I just want to say make sure to watch it from start to finish so that you don't miss a detail that pertains to you, especially when it comes to something like health insurance or Medicare. Some of the information is critical, and a lot of people don't know kind of what's what when it comes to Medicare or really anything Social Security related, as far as the little nuanced details that just can make such a difference for some people. All right, so again, please make sure to watch the video in its entirety. So typically, whenever we're talking about Medicare, I would say the overwhelming majority of people know that you can get Medicare based off of your age, which is 65. And the second way to get it is from being on Social Security disability. So in order to get disability-related Medicare, age-based Medicare is pretty straightforward. It's based off your age. You have to be 65. That's pretty much it. In regards to disability-related Medicare, you have to be on your Social Security disability benefits have to be running for 24 months for you to be eligible for Medicare based on that disability. So it really depends on, one, when they found you to be disabled, and two, when your benefits were effective. So as an example, if you were found to be disabled on, let's say January 1st of 2023, there's something called a 5-month waiting period. So once you're found to be disabled for SSDI, the first 5 months, there's no benefits that are able to be paid, and nothing is effective at that point. So if you are found to be disabled January 1st of 2023, your 5-month waiting period would be January, February, March, April, May. Your month of entitlement to SSDI would be June. Social Security benefits are paid a month behind, so your first payment would be in July. So assuming that your benefits were effective with June of 2023, so that means in June of 2025 is when you would first be eligible, or entitled, I should say, to Medicare. Now, if you're somebody who, let's say that you're married and your spouse is working and maybe your spouse has health insurance through their job, you might want to refuse Medicare Part B, which is the one that you have to pay for, just so that there's nothing more coming out of your pocket. Before you make a decision like that, I would always consult with whoever your health insurance carrier is to make sure that there's not any sort of clause where if you're eligible for Medicare, you have to take it. And the reason for that being is because usually any sort of state or federal insurance becomes primary. And as a private company, such as a health insurance company, obviously their business model to make money is to not pay benefits if they don't have to. So if in their policy it states, if you become eligible for Medicare or Medicaid, you must take it. Otherwise, we might reject your bill or drop you from the policy, whatever it might be. That would be a very good question to ask if you're going through a period of disability and you're looking at Medicare possibly starting soon, and kind of knowing what to do so that you don't jam yourself up as far as any medical bills or anything like that. There's a few different things on here. I'm just going to go over what's most common. If you receive a disability pension from the Railroad Retirement Board, which is RRB, and meet certain conditions, this is a very small demographic of people, and it's very rare. I will tell you that the Railroad Retirement Board usually has jurisdiction over what SSA does, so they actually make the determination of who's going to pay what. If you didn't know, the Railroad Retirement Board is kind of like a private pension system, so if you're an employee of them, you're not paying Social Security taxes, you're paying into the Railroad Retirement Board instead. But because of unions and government and things like that, they're kind of connected, I guess you could say. You receive SSDI benefits because you have Lou Gehrig's disease, or other known as ALS. In the almost 8 years that I worked at Social Security, I have never once seen a claim for ALS. I believe on top of this, ALS is one of those conditions that basically gets you instant Medicare, from what I've heard. I've never been in a position to where I needed to research the policy. I'll probably be doing that soon, just to make a video on it so people are more educated. I'm sure you could go to Google, type in SSA, and then I'm not even sure how to pronounce this, but ALS Medicare, and you'll probably get some information that you need. I would read it very thoroughly, though. You worked long enough in a government job through which you paid Medicare taxes and have met requirements of the SSDI program for 24 months. I'm not 100% certain what this is referring to. This kind of implies like if you work in a state where you had a private pension system and you didn't pay Social Security taxes, but maybe you paid Medicare taxes, which I still believe you would do. Then if let's say you filed for disability benefits, you might get a technical denial for SSDI purposes because, again, you're not paying into Social Security, you're paying into a private pension system. But if you still paid Medicare taxes, let's say that they technically denied your DI claim but still found you to be disabled, then they might give you Medicare because, again, you paid those Medicare taxes. So they're going to basically pretend like you're on SSDI but still give you the Medicare. I would imagine is probably what that's relating to, and maybe even tied to this situation up here with the Railroad Board. If you're a child or surviving spouse age 50 or older, including a divorced surviving spouse of a worker who worked long enough under Social Security or in a Medicare covered job, and you meet the requirements of the SSDI program. Realistically, this is talking about if you're filing for benefits as a disabled widow, a divorced disabled widow, or a disabled adult child. So this is where you're found to be disabled before the age of 22. So that's talking about any sort of auxiliary disability claims off of somebody else's record. And then the last one here, I would say this is actually fairly common because unfortunately diabetes is a big thing in the United States. You have permanent kidney failure or end-stage renal disease, ESRD, and you receive maintenance dialysis or a kidney transplant, and one of the following applies. So again, this is kind of going into this top chart here. It's kind of breaking everything down in the same way. So there's not only do you have to meet medical requirements, but you have to meet non-medical requirements, which is the various entitlement criteria needed through the Social Security program. So that's kind of what these little bullet points are talking about here, which is basically repeating the same thing. That's pretty much going to wrap it up for the video today. If you enjoyed it, you learned something, you got something out of it, please give the video a like. It does help out the algorithm and help spread this video and the channel out to other people searching for the same information you are. If you had a question about anything I covered, leave a comment down below and I'll reply as soon as I can. And please consider subscribing to the channel and turning on your bell notifications so that you're always notified whenever I'm posting a new video. Thank you so much. Have a good day.